the Council of Community Leaders. Danica, thanks for getting us recorded. I am bringing greetings from Teresa Forthofer, who's not able to be with us at the top of the hour. Teresa is our chair, and she'll join us partway through the meeting. I especially want to thank first-time attenders and want you to know how much we need your insights in the deliberation today. So everyone in this call, your insights and your inputs are important to us. Our mission is collaboration for a strong human services system. And to collaborate well, we make a commitment to know each other and to build trust. So let's take 10 minutes now in breakout rooms to reacquaint ourselves with each other, or for some, it might be a first-time introduction. And perhaps after you've given your name and your affiliation and what you do in your role in your affiliation, you might think about responding to a prompt question that aligns with today's topic. And that prompt question is, what's your favorite way, or what is a favorite memory of being greeted and inquired about? Could that be language or phrase or motion? That is, what's the favorite way or best way that you've had someone say, hello, how are you? So let's do that now. Danica, or Ava, whoever is on the breakout rooms, let's set up 4 rooms, please.
I am on it. Here we
Thank
go.
you.
We have the 4 rooms, and I am opening them. We are randomly selected. Please join the room after the invitation. I'm sorry, Dave, have you mentioned how much time we spend in the room so everybody has an idea?
Yeah, let's take 10 minutes. That'll give us a couple of minutes per person.
Thank you. I am opening them now. Hi, Sue. Can you hear me?
Hi, yes.
Hello, Sue. This is Ava. We just started joining breakout rooms for a little welcome and little introduction.
Okay.
Let me assign you to one of those rooms. I am staying in the main room just in case more people are arriving.
All right,
a bit
thank
late.
you.
Okay. Okay, so I am assigning you to room 4.
Okay, okay.
Thank you. Hello, Sarah. Can you hear me? You are muted. I can't hear you.
I'm good. Other than my screen, my video camera is bad. So
That's okay. Hello. We just started joining breakout rooms for a little bit of saying hello and introductions. Let me assign you to one. Please join that room, and then we will reconvene here in the main one.
Okay, great.
I am assigning you to room 1.
Okay, great. Thank you.
Thank you. Yes, oké. Na nem fúj a szél, de gondoltam tedd ide azért a török között, de hát nem fúj a szél. A farkas cipője be lett hozva? Oké. Hát, jó van. Hát, ha lesz annyi, hogy új tetőt is csináltathatunk. Ja. Dave, you are muted.
Welcome back, all. I hope you had the good experience that we did of the variety of great ways to be warm and welcoming from all ages and from every part of the globe. Today, I'd like us now to focus on our topic. We want all our neighbors to have optimal health and well-being, with no one disadvantaged by language. Our focus today is language appropriate service and care, and specifically language access services as opportunities to improve equity. We will do two things. We will hear a presentation from Eva Rafash, Senior Program Director for Language Access Resource Center at DuPage Federation, and we will break into 3 groups for discussion to learn the specific steps that we've found helpful in our world regarding language access, the challenges that we face in our specific circumstances, and the changes that would help us in our work. As a result of these 2 things, our goal today is that each of us will gain information that helps us in our community, organization, or mission. And as a council and a planning agency, we will identify what we can do to improve language appropriate service and care. So I want to introduce Eva, and this is a great pleasure for me. When I arrived here about 4 years ago, I took a drive with Eva out to DeKalb, and we talked to a patient services rep there about language. And I learned so much. And I learned about her ability to listen to what's going on in an organization and provide instant good ideas on what can be done to improve language access. So I know that Eva Rafash is a dedicated advocate for language access. She is, as I said, Senior Program Director for LARC here. She is a teacher by nature, skill, and training. She has a bachelor's degree in elementary education with emphasis on art and biology, and she taught in the school system for over 20 years. She's also completed the nonprofit organizational leadership certificate program at Northwestern University Kellogg School of Management. She joined LARC and DuPage Federation in 2012 after completing the interpreter training. And now as Senior Program Director, she's expanded our training curriculum to support bilingual persons who want to improve their skill and understanding of interpretation. And she's developed an extensive array of support workshops for interpreters looking to improve their knowledge and skill. She's been a marvelous innovator to quickly stand up language access capacity to support new immigrants, refugees, and asylum seekers. So, Eva, I'd like to hand you the microphone.
Thank you so much for the introduction, Dave. Good afternoon, everyone. Let me start with sharing my screen, and we can take it from there. Here we go. So I am going to be talking today about language access, the importance of language access and how to utilize interpreters, what are the laws and everything behind this service and industry. Here we go. So let me move. There you go. The first few slides are what we usually start with, but since all of you are familiar with the Federation, I am not going to expand on this. It talks about the Federation and our goals and our primary programs with community planning, training, and technical assistance, and LARC, the Language Access Resource Center. As you know, LARC is our social enterprise. In addition to providing interpretation and translation services to our neighbors, we also assess proficiency of bilingual staff and provide training so they become trained interpreters. And I will elaborate on these in a tad bit later. So let's start with the educational part. It says when individuals with limited English proficiency, LEP, can communicate effectively with your program staff and participate in your programs and services. That would be language access. So when we discuss language access, what do we mean? Essentially, we are talking about how to communicate with and provide services to someone who does not speak your language, English, or so they can have equitable access to services and programs. Some of you from the educational background, LEP, the description might sound like EB, the emerging bilingual. In other sectors, LEP is still used to identify those who speak English with less than proficient level, and they might need interpretation or translation services. Why is language access important? So after this presentation, we are going to have an opportunity to discuss these in a breakout rooms. And let's just point out a few common themes. We can point to the increasing diversity through the United States, including Chicago and the suburbs over the past 20 plus years. Planning for language access can reduce barriers to service and reduce conflict that may come about because of misunderstandings or the inability to receive the same level of services as English-speaking neighbors. Ideally, language access services improve outcomes, whether that is a health status, educational attainment, compliance with city regulations, or pretty much anything else as well. In the end, language access is an expectation of the federal and state law, and we will discuss these laws shortly. Some statistics, nationwide, 1 in 5 children under age of 6 is a child of an immigrant parent. Today's immigrants are more diverse than earlier generations. And approximately 19.5% of the population 5 years or older speak another language than English at home. What is limited English proficiency, LEP? It does not mean someone does not speak English at all, but they might not speak it with full proficiency and they have limited ability to read, speak, write, and understand the language. What is an interpreter and who is a translator? It is commonly used interchangeably, but these two terms are not the same. Interpreters are very proud of their interpreter work. Translators are very proud of their translator profession. So which is which? Now, the one who converts spoken messages through oral modality, that is the speech-to-speech from one language to another, that is an interpreter. When this language conversion happens in writing from document to document, from one language to another, that is a translator's work. Bilingual staff. Well, the bilingual staff definition made its way to this presentation because oftentimes various organizations do not utilize services of trained interpreters, but rely on assistance of their bilingual staff. Bilingual staff may or may not be proficient in those two languages, one of them being English, and may or may not have had formal training in the target language. Bilingual individuals are not the same as interpreters. Just because someone speaks another language, it does not make them an interpreter. Let's talk a little bit about who is an interpreter. So as the bilingual staff may not be proficient in all of those language skills, they do work with LEP clients. But when they directly work with a non-English speaking client, they are not using their bilingual skills per se, because that conversational assistance happens solely in that other language, so that is still a monolingual service. The problem comes when the bilingual staff member is being pulled away from their own responsibilities and being utilized as an interpreter to assist other co-workers' clients or their own clients. They would be accompanying them to another office or to assist with another service where they would be act as an interpreter. Now let's see about trained interpreters. The interpreter training journey starts with the language proficiency assessment and evaluation. What is being assessed there would be their reading, writing, speaking, and comprehension in both languages, and speaking, of course, and they would need to have a sufficient passing grade from that assessment to be able to participate in an interpreter training. Now, the training is regulated as of a minimum of 40 hours of training. Our LARC trainings will comply with this because our trainings are 60 or 80 hours coursework. So we definitely do more than the minimum of 40 needed. And I always challenge our students when we talk about the minimum of 40 is the requirement officially, that after we are done with the training, you tell me which 20 hours you would like to get rid of from the program. They, of course, would never say what, because anything we learn about, it is even a squeeze to try to fit into 60 or 80 hours. There is so much to this. They come in with and we further their skills in interpersonal and public speaking skills. They learn about the National Code of Ethics and the National Standards of Practice for Interpreters. And they gain some working knowledge of various systems where interpretation is used. Of course, this is all on top of the interpreter techniques, the interpreter skills, and everything that goes with the profession. Interpreters work with the public and with various providers. It is also very important that we educate the providers as well, because if they have not worked with interpreters before, they might not know what to expect and what is the best way to utilize their services. Providers need to know that sometimes there is no exact equivalent of certain words or concepts in that target language, because the medical system or the educational system might be different from the ones that we know here. And sometimes the interpreter needs to ask for further information. The interpreter cannot give explanation, even if they know about something, but they always interpret what is being said. So if further description or explanation is needed, that needs to come from the provider. The provider needs to make sure that forms and letters or other communication do not direct the clients to bring an interpreter with them. This is against the law, and we are going to talk about that in a minute. Also, we should never, ever use minors under 18 to interpret. If there is no interpreter in the school, we cannot have that student to interpret for the parents for that IEP meeting or parent-teacher conference or anything like that. It is not okay to use children. Well, it is not okay to use untrained interpreters, but it is definitely not okay to use children to interpret. Trained interpreters are knowledgeable about confidentiality, impartiality, not to advocate, stay neutral in the situation and such. It is very important to obtain a neutral interpreter, especially in sensitive situations, such as domestic violence or anything else. You do not want family members to interpret, you do not want close friends, or it can be even troublesome to have community member who is part of that same ethnic group to interpret, because they might be biased. It is very hard to stay neutral, and it goes both ways. If they are friends, then it's the positivity that can bring that balance out of shape. Or if they happen to not like each other, well, that is not a balanced situation either. So we don't have to be emotionally involved, and that is the best if we have a neutral interpreter. Now, what is the successful process? Well, we are going to go with those numbers. Ensures clients and provider communicate with each other directly. Trained interpreters know that the interpreter's job is to provide the voice. We are the voice of the communication, not part of the communication, but we lend that voice. The goal is to have the client and the provider communicate with each other directly. Not he said, she said, and asking things from the interpreter, but they communicate with each other, and the interpreter is there to assist with that. The interpreter's job is to convey the message effectively and accurately. Accurately as much as possible. It doesn't always mean word by word. Because of the linguistic differences, it might not be word by word, but it is always conveying the meaning of the speech accurately. Facilitate the communication between two parties. The interpreter is promoting that client and provider independence, that they speak for themselves and they resolve any issues together. The interpreter is providing the voice so they can do that. Maintain confidentiality. I always joke with our students that interpretation is like Vegas. Whatever happens in Vegas stays in Vegas. That goes for all interpreting encounters as well. Nothing leaves with the interpreter. Confidentiality is utmost importance. The interpreter leaves the room when the provider or the staff member leaves the room. It is because interpretation can only happen when all participants are present. That's called a triadic relationship, because we have a client, a provider, and an interpreter. If they are all present, interpretation and communication can happen. If we are removing any of these three participants, that's not interpretation anymore. Either they cannot communicate, or the communication happens in one language. So no interpretation. If there is no interpretation, the interpreter should not be present, because staying alone with the client can lead to all sorts of unintended consequences. The client might disclose something to the interpreter that the provider doesn't know about, or asks the interpreter for their opinion or to explain something. These are all situations that the interpreters need to avoid. Let's talk a little bit about the law. I was referring to that we have federal and state laws regulating language access. That would be, federal law is Title VI, the Civil Rights Act of 1964, and the Executive Order from 2000, and also the Americans with Disabilities Act. And the state law is the Illinois Language Assistance Services Act. I will just provide a brief overview of these three laws, but please know that there are quite a number of resources on the topic of language access and best practices. There are many standards and toolkits that have been developed by various agencies like the U.S. Department of Health and Human Services and others. So Title VI, the two main legal bases for language access are Title VI of the Civil Rights Act of 1964, which prohibits the discrimination based on national origin, and the 2000s Executive Order, which affirms Title VI language access requirements and outlines some additional requirements. In some cases, individual states and municipalities have enacted their own language access regulations, and some regulations largely reinforce Title VI and EO 13166, while others include specifics regarding the language access planning and implementation. Anyone receiving federal support, even indirectly, is required to provide language access. Title VI applies to a recipient's entire program or activity. This means all parts of the recipient's operations are covered, regardless of whether the recipient is only partially funded through federal funds or fully. Language access requirements are relevant to a wide variety of programs, organizations, and agencies. These protections offered under Title VI include actions that delay, deny, or provide different quality services to a particular individual or group of individuals. Title VI requires meaningful access. So the organizations that receive federal funds are required to take reasonable steps to ensure meaningful access to the services and programs provided to LEP persons. Requires provision of language assistance services, including bilingual personnel, interpreter services, and all this at no cost to the actual LEP person. And these services are required at all key points of contact in a timely manner. There is a self-assessment and planning tool that can help agencies to determine how to provide meaningful access to for the LEP persons. This approach takes into account an agency's mission, the population served from both linguistics and cultural context, the importance of the service provided, and the program that is available for the resources when establishing language access policies and plans. This would be the 4-factor analysis that is the last note on this page. Let's talk a little bit about this 4-factor analysis. So one of the tools used to help entities to plan for language access is this. It helps entities to understand the makeup of the LEP population in their communities. When planning for language access and cultural competency, the 4-factor analysis helps to direct these efforts and resources. We, as of LARC and the Federation, have provided technical assistance to various organizations who have been interested in developing their own language access plan. And in that training, we utilized this same tool. So they need to think of the number or proportion of eligible LEP customers, how many LEP individuals are eligible to be served within your organization or project area. What are the top 5 languages at your organization, and what is the frequency of the contact? Number 2, for the frequency, further details are: does your organization have a process for surveying, collecting, and or recording the primary language data for clients served? How would you describe that process? What are the steps to be taken? How many actual LEP individuals received services at your organization during the previous fiscal year? What are the primary languages of these individuals served at your organization during that mentioned time period? Factor 3 would be the importance or the impact of the contact upon the lives of the person served. Here, there would be a list of services that the organization provides. And the fourth factor is the resources available. And a whole bunch of questions again. What are the resources needed at your organization that provides meaningful access for those LEP persons? Is there a staff member or multiple staff members in your organization to assign, to coordinate, or to facilitate any of these language access activities? What are the point of contacts where an LEP person interacts with your organization? How many direct service or frontline staff members are employed at your agency that are bilingual? What are those languages? Do they serve and reflect the makeup of your clientele? Does your organization have a certification or an assessment process that the staff must complete before serving as interpreters? Remember, we talked about bilingual staff members. They might or might not be trained. They might or might not be assessed in their language. Just because someone claims to speak a language, if they have not completed a language proficiency assessment, we don't know what's the level of their language. It makes a big difference if someone speaks a language because it is a home language, heritage speakers who learn the language from the grandparents, or the parents still speak it at home, but they have never received education in that language. They might be very functional, at family gatherings and can talk to their relatives, but they would be in trouble with vocabulary or a higher register conversation, or they don't know how to read and write that language. So it makes a difference what's the level of their language knowledge. So that proficiency exam, does it include use of standardized language exams? How is it determined? Does your organization provide professional interpreter services? What interpreter services available at your organization? In a little bit, I will be talking about various ways that Lark assists our customers, and you will see interpretation can happen in various modes and modalities. Are there any instances when your organization permits the use of informal interpreters, meaning untrained interpreters, family members, friends? If this is the case, under what circumstances it is allowed that they would be assisting? Do you have any plans to change that practice? Does your agency or organization have any limitations on resources that would negatively impact how you provide provisions for language assistance services? Do you offer your printed materials or any written communication in alternative formats? And are they translated? So the process to decide on language assistance or form your own language assistance plan is usually based on this 4-factor analysis. And this is something that usually on a yearly basis is going to be reviewed, because needs might change, languages might change, the makeup of your clientele might change. Who are the covered entities? So this slide shows you the types of entities that may receive federal funding directly or indirectly, and therefore required to comply with Title VI. Obviously, this is not a full list. It is just a few examples, but even from here, you can see it pretty much includes every area of our lives, communities, and services. You are all familiar with Title VI, I'm pretty sure. It is the federal law that protects persons from discrimination based on their race, color, national origin in programs and activities that receive that federal assistance. The part of it that says national origin, that is what directly applies to the language-based discrimination. Yes. I don't want to give you too much information that you don't need at the moment. So I'm going to stop here with this and then let's move on. Dave, please give me a time check because I failed to note when I started talking how much time I have.
We've still got another 15 minutes.
15 minutes. Awesome. Okay. Thank you so much. Okay. Title 3, Title 3 prohibits discrimination on the basis of disability and place of public accommodation. You are perhaps familiar with as well. Under this act would fall all the accessibility, you know, for ramps and other building accessibility too. But it also applies to language services because language access component is not only the provision of qualified interpreters, but also auxiliary aids to ensure effective communication with individuals who have hearing, vision, or speech impairments. So under the language access, we would need to include deaf and hard of hearing persons as well. These aids must be provided to ensure effective communication with individuals who have these disabilities or impairments, and that would be qualified interpreters, in this case ASL, what stands for American Sign Language, and CDI, what stands for Certified Deaf Interpreter. Just for those of you who might not know the difference between the two, ASL interpreters are hearing and speaking individuals who are proficient in English and they are proficient in American Sign Language. So they can hear the speaker's words, turn that into sign language and communicate it to the deaf or hearing impaired person, and then they do it in reverse and speak on the behalf of the client who communicates with signs. CDIs are certified deaf interpreters, and as the name says, those interpreters are deaf themselves. Sometimes they are mute as well. But it means they are the ones who facilitate communication with all those individuals who might not use ASL. ASL is American Sign Language. There are about another 140 sign languages. And depending on if the deaf person or hearing impaired person ever learned ASL, or they are using fingerspelling or any other sign language or homegrown signs, the CDI interpreter is the one in multilingual in those sign languages. And it goes in a way that, let's say I have a doctor, the doctor speaks English. The ASL interpreter can hear, turns it into sign language. The CDI understands ASL and then turns to the client and signs it in a different sign language that the client understands. And then we are going in reverse. Client signs their signs, CDI understands, turns it into ASL, ASL interpreter speaks it out. It might sound like relay interpretation, troublesome, time-consuming, yes, but everybody is included, everybody is receiving services, and they are happy because professionals are assisting. So that would be for interpreters, but it also includes note takers, computer-aided transcription services, various written materials to be provided, assistive listening devices and systems, phone communication services for deaf persons, telephone handset that amplifies, or TTI, what provides the written text, video interpretive services, and such. We are back to covered entities. Who is covered by Title 3? Pretty much everybody, just like the previous slide for Title 6. There is no difference. Here is Illinois Language Assistance Services Act. Illinois Language Assistance Services Act is directed at health facilities and regulated through the Illinois Department of Public Health. It pretty much covers the same idea as Title 6. You could ask, why do we have a law that is nearly identical? Well, if anything would ever happen to the federal law, and in some previous administrations' efforts to curb language access, we could have seen worse than we already did, but anything might happen at the federal level. Illinois still does have protections, and we have a law that requires these services. On the top of that, there are some other examples of ordinances or even policies. The city of Chicago passed an ordinance about language access. The Illinois Language Assistance Services Act mandates that the health facilities adopt and review annually the policy for providing language access services to patients and residents with the communication barrier. They develop and post notices that advises the patients at these services at every main entry point, and notify the facilities employees that the language services are available so they can utilize this service. Where does LARC comes into this picture? So what does LARC do? I am going to bring up all of these so we can talk. Oops, sorry. We can talk a little bit about it. LARC provides interpretation services. Interpretation is the spoken to spoken. We assist interpretation in various modalities. It would be in person, face to face. We also offer video remote that can be through any platform the client favors. Can it be Zoom, GoToMeeting, Microsoft Teams, you name it, our interpreters are going to be able to assist. So that is video, and we also offer telephonic services. That is OPI for sure, over the phone interpretation. We offer document translation services. Translation is the written to written, but we include some non-traditional services in the translation as well. We provide translation for forms, emails, report cards, you name it, anything that is a file. But we can also provide assistance with your audio recordings. We can transcribe, we can translate of your audio or video recordings as well, and provide subtitles or transcripts. LARC also conducts interpreter trainings and workshops. Interpreter trainings are for those bilingual individuals who have successfully passed their language assessment, and they would like to learn how to be interpreters and willing to take that lengthy course that we offer. We do have various different trainings, whatever fits their needs the best. They differ in the number of hours and the commitment, the weekly and monthly commitment. And we can also customize some of our curriculums to fit the client's needs. The interpreter training is for newbies, bilingual individuals who want to learn how to be interpreters. Now, the workshops that we offer, that is a continuing education professional development opportunity for our trained interpreters. These workshops are assisting them to stay in the game, to further their vocabulary, their knowledge of various very specific areas. Whoever completed the interpreter training, that is a good base. That's where we start, but it's a never-ending story. We cannot stay still. We always have to learn more and more and more, because the world around us is changing and our vocabulary has to reflect that. So workshops. The proficiency assessment. Logic would say that proficiency assessment would be before the interpreter training in this list. Why it made its way to after that? Because we already mentioned that, yes, it is the first step for the interpreter training, but we also provide proficiency assessment as needed for other organizations who wants to see if their bilingual employees are truly bilingual. They might or might not become our students after that. Sometimes that organization just would like to have an idea that those employees claim to be bilingual. Are they truly bilingual? So proficiency assessment is another thing we do. And the technical assistance and consultations. We are always available to assist. Has anyone have any concerns or questions, or would like to figure out what is the best way to assist their clients? We are available for consultation to figure that out together. And also technical assistance, but in these just soon after COVID times, it means that we are still assisting with how to proficiently use Zoom, how to set up something, what are the technology details that the client might be new to, but we have experience because we have been working with our interpreters and other customers for years now. So we are happy to pass that on. Face-to-face and the in-person and the video remote interpreting is conducted by our local interpreters over 40 languages, including ASL, and may I add, we also work with CDI interpreters, so we have access to that as well. Ease of scheduling would be contact with our office, and we utilize an online scheduling system called Fluency, which can accept direct entries from the requesters, and then we can assign interpreters to those. This is a language list that changes. Interpreters sometimes come and go, and we're always happy to gain new languages when a fresh class just finished and we have a language speaker in that class who is becoming an interpreter after being student, and an extern completing their hours, and we can add them to the list. The telephonic interpretation is only over telephone, and actually I should have changed that. The over 200 languages now is over 260 languages, and telephonic interpretation is in cooperation with our telephonic partner. We do not have our own call center. That would be such a huge operation and cost, so that's why the cooperation. But our clients are provided with an 800 number for that immediate access, and they can utilize that any day, any time, for their interpreting needs for those over 260 languages. And let me talk just a little bit about translation, and we are almost done. So document translation are available in all languages. It's pretty much all languages. For all those 10 years I have been with LARC, last week it happened for the first time that we have received a request for a language called Minna that I never heard of before, and we were not able to help with Minna. But all the other hundreds of other languages, we have been quite successful. The translation is done by translators and linguists who we have access to, not by our interpreters. Our local interpreters do the interpretation, translators and linguists do the translation. As I mentioned, we can do non-traditional work as well, translating, transcribing, and doing subtitles for videos. And these qualified professional translators are utilized with for this task. Wide variety of subject matter. Our translations range from all educational documents, including report cards, various registration forms or communication with parents, but it can be users guides, manuals, employee handbooks. It can be medical records from other countries, research work, anything. We have seen so many interesting documents coming through our office. It is a joy to assist with any of these requests. Okay, I have 20 seconds left. I think I am going to stop talking right here. Let me stop sharing. Thank you so much for listening. I would be happy to respond to any questions, concerns, any clarification questions that you might have, but I know Dave planned a discussion for us. Dave?
Let's take a minute to ask about questions. In addition, I want you to know that when we move into our breakout groups, Ava's going to travel among the groups and will be available there to weigh in as well. But I do want to ask with the big group here, are there questions like factual questions or things that you thought about and tried and you wondered how that fits in? Any questions for Ava?
Thank you. That was very informative. I do have a question. I can see the value of this presentation being done for our many Chamber of Commerces across DuPage County. So often, businesses are not aware that these kinds of services are available. Have you or are you planning to make those connections?
Yes, and we are already working on this presentation. Has been utilized at various city hall meetings and various professional organizations meetings. So I am available for any group, provider team, or any organization who would like to learn more.
Ava, how often or how frequently are you involved in doing interpretation services for our public safety, police or fire services in county?
Oh, very good question. Police and fire safety, not very often. I cannot recall any single time that we would have been involved with any fire departments, and very few cases when we assisted the police. And I have been working on this and made some outreach attempts and talked to people about police work. And my experience is that police does not like to bring in interpreters, and they would rather use bilingual police officers just to keep everything within in their organization. And also they are not very well versed in understanding how they can request an interpreter. And they think it is overly complicated, or they are not even aware of the services, and they are not overly concerned about following the law, not because they are breaking the law, but they are not aware of the actual requirements. Those few times when we worked with the police, it was only because they did not have a police officer who speaks that language. And they couldn't make any understanding with the people. And as a last resort, they reached out to us. It happened for, I actually can recite them. It happened for a very small African tribal language that they didn't have anybody, and at that time we were involved. It happened with a more common Asian language, what is becoming more and more prevalent in DuPage County, but they didn't have any officers yet who would speak that language. And it also happened with ASL because we didn't have any police officer who was able to communicate in sign language.
That might be an interesting discussion to have with the sheriff's department. I will tell you, I interact with the police pretty often just because of the nature of our work and them trying to assist. There's timeliness, but there's also like a lot of safety. You know what I mean? Like they don't usually, even with us, they won't let us approach until it's safe. And so I could see that being like trying to find that balance there would be interesting. But I can't imagine the sheriff's department not wanting to have a conversation about how you find that balance between the two. If it's helpful, I'd be happy to help facilitate. Again, we work with the police so often because folks are unsheltered and they refer to us. So please use me if I can be helpful in having starting a conversation there.
Thank you. Thank you so much, April. Few years back, now it's more than a few years back, there was a case in Lake County where they used a police officer who is from Korean ethnicity as an interpreter in a case where the son died, and according to the police officer's interpretation, the father killed the son. And
Wow.
and it turned out after a lengthy process that was not the case. It was a misinterpretation, cultural misunderstanding, because the Korean-speaking officer was a very young 20-something police officer whose home language was Korean, but he was born here, but understood, but they used him for the interpretation. And when the father, in his grief, cultural difference, was proclaiming something that it is my mistake, I killed my son, it is my fault, that while it was an actual suicide. And it was interpreted straight as of a confession. And the father was convicted and thrown into jail, and it took quite a while to straighten all this out. And it turned out it was a miscommunication because they didn't use interpreters. So it can be quite serious. Yeah, I appreciate your offer, April. Thank you.
I also think reaching out to the state's attorney's office, who has a lot of connections with every police chief in the DuPage County, might be helpful. They do regular presentations. They meet monthly. So it might be an opportunity to at least start dialoguing there.
Thank you. We already started building a great relationship with the Lake County State Attorney's Office. Yes, we provide interpreters. Our interpreters go to the court. They work with their office, and building on that experience, I really would like to further it and work in DuPage as well.
Sue, you had a question too.
Yeah, I don't know if it's a question or a comment, but I have noticed that when we go to pay for our services to the village hall, and maybe a couple cities that I have noticed, I don't see that there are any signs offering interpretation services. And I just very recently, maybe last year, is when I learned, thanks to Ava, sharing a presentation, I learned that this is a service that needs to be provided. And, not only that, but there has to be a visible sign telling people that this is available at no cost. So seems to me that we have a lot of work to do there, a big campaign or something we can do together to bring awareness to the people, but also to the organizations. So I have a question. If somebody is stopped by the police, can this person request an interpreter even though the police officer speaks the language?
They can. They can.
If the police officer understands them to know the request, which is
Well, I'm
Okay.
saying if I speak Spanish and the police officer also speaks Spanish, but with an
You
accent.
still can ask for an interpreter, a
ask,
professional
okay.
interpreter. And I saw the question in the chat box if Lark provides signs. We do have language identifier assistance that would be I didn't think of bringing that here. That is literally a sign in various languages. It says, I speak so and so language, I need an interpreter. And it is in multiple languages on that page. So if you don't know what that person speaks, this page can be shown to them and they can point on the writing that they recognize, given if they are literate and they can read it. But it is like a language sign that can be used. There is also a sign that probably yourself you have seen if you go to a hospital or medical facilities, that is usually posted by the main entry points, like the Illinois law requires, emergency room, check-in desk, things like that, that says interpretation is provided to you at no cost. And let the personnel know that you need it. And it is usually a generous big sign because it is in multiple languages, the same phrase. So we do have electronic versions of this. We do not have actual signs like a hard copy sign that we can give to people. But if somebody is interested, we have some resources, yes.
Eva, real quickly, just to speak to what April talked about, the officers needs to have control of a situation before they can allow interpreters or anyone else to intervene. Are you then open to some kind of co-training with the officers and the interpreters to know, to have a better sense of how to and when to intervene?
I would envision this cooperation in a way that first we all need to learn, including myself, more about how the police works and what is working for them and how can we assist that, not hinder. We would need a training for the interpreters in this specific area that emphasizes what is the special about this and how to help, but also a training for the police officers about how to utilize the interpreters, what the interpreters can or cannot do, what they can't be used or cannot be used to. So everybody has a role and we have to stick to those role boundaries, because they cannot have the interpreter to do something that's not the interpreter's work. The interpreter cannot bring in there something that is not appropriate to the situation and such. So I would imagine that it would require prior work between myself and various contacts to work out a plan and some training materials. And then we would prepare all participants, both from the provider side and the interpreters, what is the best course of action.
Thanks, Ava. I'm going to jump in here and suggest we do one more thing, our breakout exercise, while we still have about 15 minutes left to do that. And Ava, I want to ask you if you would make co-hosts Beth and me so that we would be able to record the breakouts when we get into them. For those of you who, perhaps there will be some who won't come into breakout, I want you to know that Danica has dropped an evaluation form into the chat, and it's very brief, less than 60 seconds. I encourage you, if you need to go before the breakouts, to please fill that out. Ava, I'll say this thanks when we come back from the breakouts, but this was just fantastic. Thank you very much.
Thank you. Dave, yourself, Beth, and Danica are all co-hosts now. How many rooms would you like, Dave?
Let's do 3. And I'll tell you folks why we want to do this. This has been a really rich discussion and thinking about ways that Lark could make a difference. Now we want to flip it and in small group, take a few minutes to ask you in your specific circumstances, what are the things that you found to be working well that we want to be sure that we're promoting? Number two, what are the specific challenges that you're facing? And the key element behind that is, what's the change that's going to make a difference for you? And then that gives us as a planning council a guide for the place we want to most focus as we go forward. So we'll have these three groups. It'll be a pretty quick discussion. We'll spend about 13 minutes together to do this, and then we'll come back for a closing.
Okay, I am opening the rooms, and then
Thank
I will be visiting each of the rooms for a few minutes, just in case if you have further questions for me. I am opening the rooms now and setting them to about 12, 13 minutes.
Thank you. Access supports appropriate care and services. 2/3 of the time, that's a benefit to citizens of the United States. Hey, thanks all for coming back. We're at 3:29. We have just 60 seconds left, but I want to thank folks in small groups for sharing what's working well in your circumstance, what's not working and what's needed to fix that. In our group, the clear theme has to do with community awareness for those who need language access services, to know to request them, and with providers to be sure that they know how to get those services for their clients who ask. I want to thank Ava for giving us the excellent presentation and for equipping us to move forward. I want to thank all of you for joining in on the conversation. We all agree that we want to provide effective, equitable, understandable, and respectful quality care and services that are responsive to diverse cultural health beliefs and practices, preferred languages, health literacy, and other communication needs. And I thank you for making your contribution for that today with your colleagues and with us as we continue our planning work at DuPage Federation. Is there anything else we should touch on before we close out at 3:30 on the dot? Okay, thanks all. We're adjourned.
Take the survey if you can.
Oh, thank you, Danica. Thanks.
Thank you, everyone. Bye-bye.